All right. Hello, everybody. Welcome to another episode of Pod Isa, the podcast that brings together innovation, quality, and patient safety in healthcare. I am Isabela Castro, as you know, your host, and today I have the honor of welcoming one of the world's leading experts in healthcare quality, Carsten Engel. Carsten Engel, who joined the International Society for Quality in Healthcare, ISQua, as the CEO in 2021. He has 18 years of experience in quality improvement, preceded by 19 years of clinical frontline service and clinical management. From 2006 up to 2021, he worked with ISQua, the Danish Institute for Quality and Accreditation in Healthcare, since 2010 as a deputy chief executive. Carsten has been a member of ISQua EEA's Accreditation Council from 2010 to 2021, deputy chair from 2016 to 2021, and he has been an ISQua expert since 2013 and was appointed as a member of the ISQua Academy in 2019. During his time with ISQua, he contributed to the development of ISQua International Accreditation Program and was also an ISQua surveyor. Welcome, Carsten. It's such a honor and pleasure to have you here with us today with the Brazilian community. Thank you so much for your time and for your availability.
You're welcome. It's my pleasure.
All right. So to start, would you mind share with us a little bit about your background, your career, how you first start in this world of quality and patient safety, and mostly your connection with ISQua and global patient safety?
Well, as you already said, I had quite a long career in clinical work before I came into quality. I am actually an anesthesiologist, and anesthesia is a specialty that's very concerned about safety. Even before the term patient safety was invented, providing safe services was essential to an anesthesiologist. As an anesthesiologist, you also work across disciplines and with many sections. So I at an early stage became aware of the complexities to making a system work smoothly. And these two approaches, smooth operations, patient safety, led me perhaps into an interest for quality and safety. But as things sometimes turn out, little contingencies can make a big difference. I was in as part of a restructuring of the hospital system in which I worked. I was asked if being a clinical quality manager would be of interest for me, and that caught to my said, well, why not try it? And I tried, and I was caught up by it. I then worked for a long time with accreditation, and it was during my work with accreditation that I really became acquainted with ISQua, because accreditation is one of the main business lines of ISQua. So when I got the opportunity to work for ISQua, it was a chance I couldn't resist, and I've been very pleased working here with good colleagues all around the world for the past 4 years. And global patient safety is a core objective, of course, of ISQua, but it has also been very satisfactory to see how the quality concept has broadened over time. Safety is one aspect of it. Let's say technical, professional quality is another aspect of it. But now we have realized that what was first called patient-centeredness, then it turned to person-centeredness. Some people now call it kin-centeredness to emphasize that we are all, whether we have a role as professionals or a role as patients, and these roles can change over time, We are related in a way that's important for the way in which we should deliver healthcare. And the other important thing is that quality has broadened out to also include sustainability, or what you might call planetary health, health of the systems, health of the individuals. All of these are related, and that has been a very interesting journey to observe.
For sure, for sure. Wonderful, wonderful. While you were speaking, I was wondering and was kind of reflecting in our work with quality improvement. One of the things we also encourage people to do is leave the conference room and go to the real world. And I think to have you as the CEO in ISQua was an incredible match, because you being a surveyor, you were in the front line of the accreditation process. You were like in the front line in the real world, and now you come and back in a 20-year-old story with ISQua, and then you become the CEO. You know pretty well how everything goes from the bottom up. And I was just reflecting sometimes how the cycle of life can be so interesting, and how everything matters in a proper moment. I'm just being philosophical.
Well, and that is very well tuned to the tagline under which ISQua works: knowledge, network, voice, but we added to it action.
Yeah, great.
Because
Yeah.
Because I mean, there is a lot of knowledge. Some of it resides with the researchers, academia. Much resides with those who work in practice. And our mission is to bring all of this together so that the work done by researchers is known to and used by practitioners, but practitioners can also bring their issues to the researchers and telling them this is something we need to know more about. This is an area where you should focus your research efforts.
Yeah, sure. I couldn't agree more. And I have to congratulate you on your journey as a CEO so far. So moving to my second question, which is a very special one for me, as I am Brazilian. We know that this year, I think the dogs agree too. See? This year, ISQua will hold its annual conference in São Paulo in partnership with the National Organization of Accreditation, ONA. And what can attendees expect from this event in São Paulo?
We have very great expectations for that event, and we have reasons for it. One of the purposes with the conference is to bring together people from all over the world and people from the place where the conference is held in any particular year. And I think we will succeed very well with this year. We always have a great international interest for the conference, but this year we also have the pleasure of seeing a very, very strong, let's say, grassroots in Brazil. All our partners have been very instrumental in building this up. We have received the largest number of abstracts ever. And you know what? The country who submitted most abstracts, what country was that? It was Brazil.
Brazil. I have the number here. 947 abstracts. Woohoo! Go Brazil! Yes. Well, we have a record, I guess. Am I right? A recorded number of abstracts. Yeah, 2,150 abstracts submitted, and almost 50% of them from our country. I'm sorry to interrupt you, but this is so exciting that I couldn't interrupt you. I'm sorry, go ahead.
No, I mean, you're absolutely to the point. And we have a lot of ambassadors who spread the rumor, the information that this is going to happen. And we are now finalizing the scientific program. We will review the abstracts, but we are already in the planning phase of the plenaries, and we will we will soon release some of the names for the panel speakers, but I can assure you we will have a very interesting mix of international voices, local voices from Brazil and from Latin America at large. And by the way, we also have a lot of patient voice included. There will be patient voice represented in most of the plenaries. We have our learning journeys where we interact with practitioners and patients, and there will be a lot of focus on the patient voice during the conference. And we will provide attendees from Brazil and from all of Latin America with very favorable rates for registration. So we hope to see a lot of our Brazilian and Latin American friends in São Paulo soon.
Wonderful. This is lovely to hear how you strategy of ISQua aims to, work in São Paulo in partnership with ONA, bringing much of patient-centeredness and quality and safety. I am sure this is going to be a super, super, super conference. And I can't miss the opportunity. I can't waste the opportunity to congratulate in advance all the ambassadors who worked so hard to promote the name of our country, the honor of our country, the honor of being such passionate and hard Brazilian workers on behalf of ONA and on behalf of our health systems, no matter if we are in the public, in the private, but we have a special spice. You should be Brazilian to know how it is. The Brazilians understand me. So I'm very proud of the work ONA has achieved. I'm one of the ambassadors too. And so, well done, guys. This was awesome. And you will see much more that what we're going to do in this conference for sure. So, Carsten, as you know that Brazil is a developing country, and we have some social and very crucial aspects in economical challenges compared to high economic countries, and there might have a reason for ISQua to have chosen Brazil as the place for the conference this year in São Paulo. So how do you see ISQua's role in advancing healthcare quality in countries like Brazil, for example, where challenges can be very different from high-income settings like in Denmark, Norway, for example?
Well, I will actually go back to knowledge network voice, because this is a question of bringing to you whatever knowledge from outside we can bring to you, but certainly also giving you a voice, because I'm sure that there's a lot of experience in your country and in country similar to your country that's very valuable. And this is the kind of experience we also want to give a voice through the conference. And that's why it's important for us that there's so many local speakers as well. And there will be a presentation, I believe, of some very interesting Brazilian projects that not only Brazil, but in fact all of the world, including high-income countries, can learn a lot from listening to.
Excellent. And about ISQua global work in healthcare quality and safety, you know that ISQua plays a crucial role in accreditation, education, and research for healthcare quality worldwide. In your point of view, what has been ISQUa's biggest impact so far?
Well, we exercise the impact through the activities you mentioned there, but what have we actually achieved through them? I would say that I have alluded to it already, but some of the important things of our impact is to broaden the view of what quality is, to include things like person-centeredness, planetary health, but also, for instance, promoting ideas about new technology, how to employ new technology. We find that sessions about artificial intelligence are very, very popular. They're always crowded when we have had those sessions in our conferences, and there will be sessions on that in São Paulo as well. We are not the technicians. Our mission would rather be to help people understand, okay, there are a lot of opportunities here. How do we make these opportunities work for us? And how do we avoid pitfalls that could be if we adopt without considering issues of safety, equity, access, things like that. And much of this is about good governance. So one of the things we should promote both at the conference, perhaps at pre-conference sessions, also through our accreditation programs, is to ensure that there is a good digital governance structure. A lot of companies will try to sell you a lot of solutions. Many of them are no doubt very good ideas, but there are pitfalls, and these are one of the things we want to make sure that people are able to understand and avoid and mitigate.
Yeah, for sure. I think literacy is one of the main principles of patient-centeredness, and one of the things we've been discussing in ISQua as well. Very well said. Very well said. Thank you. And Carsten, in your opinion, with such an experience in this world, what do you think are the biggest challenges in healthcare systems when we are trying to implement meaningful patient safety measures, especially in developing countries like Brazil?
Well, WHO issued a report, a global patient safety report in 2024. And the conclusion is, unfortunately, we are still not there. 25 years ago, the world was surprised by learning that 10 to 15% of hospital admissions, for instance, result in some degree of harm to the patient. Unfortunately, the situation has not improved. It's still the same. Some new studies show that 12% of patients experience harm. As much as 12% of adverse events cause permanent disability or patient death. Unsafe care is among the 10 leading causes of death in the world. More than 3 million deaths every year, and around 2/3 of them in LMICs, which should not leave you, on the other hand, to believe that care is extremely safe in high-income countries, but because that's not the case. And why is that so? I mean, one of the things is that we should not forget that there's been a lot of innovations during those 25 years. Complexity has increased very much. That just keeping pace with that would have been a challenge in itself. But I think that today we should say that delivering safe care is not so much a technical problem, apart from the problems, of course, associated with safeguarding new technologies. We know a lot of what we need to do, and it's very nicely summarized in the Global Patient Safety Action Plan of WHO. The challenges is that it's hard to develop a patient safety culture. Implementation is hard. Making care safer is not so much a technical project as an implementation, a social project, and we need to understand and leverage everything we know about implementation science. And then there's, of course, the issue of resources, both financial and human resources. In many countries, we face shortage of staff, resulting in the risk for burnout of staff. And sometimes the concept comes up that we should protect staff against disturbances, and quality and safety projects can unfortunately be seen as disturbances. But I would say that we know that 60% of care is delivered in accordance with evidence-based guidelines and established good practice. 30% is waste, doesn't make any difference. 10% causes harm. So there's a lot of waste. Patient safety and better quality is not just about spending a lot of more money and resources. It's actually about eliminating waste and making life easier for staff. And the patient voice is important in this as well, not just because patients provide us with other perspectives of what safety is, but also because at the end of the day, we must realize that we can't perhaps do everything that's technically possible. We need to make some choices. And how should we make these choices? Well, they should be made on basis of the core question defining person-centeredness, what matters to you. So we should involve patients and staff as partners in answering such questions, because one of the in my opinion, the primary reasons for burnout is that you feel that you are not able to meet expectations. So the challenge is we need to define expectations that are realistic and that are in line with what we as partners, as kin, think are important. Make expectations that we can realistically achieve, and then work together to actually achieve it.
Yeah, I completely agree with you. And, for us in Brazil, we are very empathetic because people from Latin America, we are very kind and empathetic. I'm not saying that others are not, but I've seen in Europe, for example, people have been trained to have about compassion. And we have this like naturally in our veins. And I just would like to add a thought in your comment about systems, because I think the systems are designed to get the results it gets. And a bad system can beat even a super champion, like a compassionate one that has chosen, like nursery, for example, that compassionate nursey that she has dreamed, she has chosen this career to improve the world, to help lives, to save lives. And suddenly she sees herself work in a setting that is structured in a bad way, like in a bad system. So I think we should promote, like you said, expectation, align communication, expectation from physicians, multi-professional teams, patients. But I think systems might be also. We need to have a look at the systems as well. I see a lot of burnout, as you said, and recently in Brazil, I think last week or this week, we had a change in the law, including mental health as a responsibility in the companies. So the companies will be responsible for mental health of their employees. That was such achievement for the employees, but is also, from the lack of a better word, I'm going to say it's a sadness. It's sad to say that we are a generation that is becoming more and more and more frustrated and anxious, and because of the problems of this new world that has come to us every day with new challenges, new problems, and which are increasing every day. So just to add a comment to your thoughts, but I couldn't agree more with what you said.
No, the system is important, and that was also, I think, one of the lessons you can learn from reading the ISQua white paper on person-centered care, because it actually highlights this trilogy: patients, professional, system, that need to work together. And sometimes the system is against Yeah, staff is against patients, patients is against system, and that's not good. And as for compassion, I think, sometimes we are so amazed by all the technical things we have to offer. And in some rich countries, we are so amazed by that we by all means we must find the means to offer patients the latest technology, the latest drug. And sometimes this happens at the cost of the time for compassion and care.
Oh, yeah. Oh, yeah. Well, unfortunately, we are reaching to close. But I can't resist to this São Paulo, Brazil 12:15 that I see in your background. The conference that's gonna happen in Brazil. So I would invite you, Carsten, to, if you could, leave a message for our audience, to our ambassadors, to encourage people to attend. We don't have a chance to submit abstracts anymore, but people still do have time to go there to the website and register and, get involved, become an ambassador, get involved with ONA, participate. Would you like to share some thoughts, leave a message for us?
Well, you have said, you have almost said it all, but I would just say, this is an opportunity. It's an opportunity for all of us to come together. I look very much forward to coming to Sao Paulo. I hope to meet and talk to many of you and come experience being part of the community that we create when we are there, all of us together, sharing the same passions, exchanging ideas.
Oh, wow. Thank you so much, Carsten. It has been an absolute pleasure having you today with us in one more episode of Pod Isa. We have covered the ISQua 2025 amazing conference that we're gonna have this year in São Paulo. ISQua's global role, a little bit of person-centered care, and we come to an end now. And before we wrap up, would you like to share any other message to healthcare professionals in Brazil or around the world who would like to, participate in ISQua, to become a member, to participate in the fellow, to get enrolled in a community of practice, how they can get in touch with you or with your team?
Well, you can find a lot of information about us on our website, ISQua.org. And you mentioned you can become a member. We have the ISQua Fellowship, which is an online but not real time opportunity to improve your knowledge in a lot of topics related to quality and safety. We actually also have a Latin American community of practice. You can read more about that on the website as well. And we have the journals. So there are a lot of ways in which you can meet and join us, and there are a lot of resources within the ISQua community that we would be very happy to share with you.
Yeah, I would like to encourage our Brazilian community. I think our São Paulo conference, ISQua's conference in São Paulo, it's a great opportunity for people to get to know more about ISQua, about ISQua's contact, for networking, for community of practice. If you have an idea, the guys from ISQua team, they are very open to new ideas. So go on, get in touch. And again, Carsten, thank you so much for your time, for your valuable insights. And get ready for São Paulo, because I'm sure the Brazilians will make a super warm and welcome to all of you. Thank you so much, Carsten. And to our listeners, don't forget to follow my Pod Isa on our streaming platforms. See you. Bye.